Today we're releasing a draft report which provides updated estimates of premature deaths associated with PM2.5 exposures. In this draft report, staff has reviewed the latest literature, developed a new relationship between long-term exposures to PM2.5 and premature death, and estimated the impacts in California. Staff's estimates of premature deaths associated with PM exposure play an important role in assessing the benefits of our plans and regulations. They also help us illustrate the cost-effectiveness of proposed regulations. Dr. Alvarado from our Health and Exposure Assessment Branch will make this morning's presentation. Doctor.
Thank you.
Thank you, Mr. Goldstein. Good morning, Chairman Nichols and members of the board. Today we're releasing a report updating ARB's methodology for estimating premature death associated with exposure to PM2.5. First, we'll discuss the background on why ARB conducts health impact analysis. Then we'll discuss the reasons for updating the methodology and how it affects our health impact estimates. Next, we'll show new estimates of deaths in the draft report and discuss our schedule for the next steps. The ARB estimates health impact associated with exposure to PM2.5 and ozone, including premature death. As part of ARB's diesel PM risk reduction plan, ARB has adopted several airborne toxic control measures. To help justify the adoption of these regulations, we've estimated benefits that would result from implementing these regulations. Since California's PM standard was last reviewed in 2002, new publications have emerged suggesting it would be appropriate for us to update the methodology. The draft report we're releasing today results from the board's request for this update and may be useful for the next round of PM standard review at both the state and federal levels. This chart shows the key steps in updating ARB's methodology. We began with a public workshop followed by a review of the literature. When we started our review, we learned that US EPA was convening a panel of world-class scientists to offer their assessment and interpretation of the scientific literature on the relationship between PM2.5 exposures and premature death. Therefore, as part of our report, we considered the results from the US EPA panel of experts and incorporated some of the relevant findings into our estimates. The report was done in consultation with OEHM, our advisors, and other experts. Based on all published results and public input, we drafted a preliminary report for peer review. After incorporating the peer review comments, we developed a draft that we are releasing for public comment today. During the next 30 days, we'll hold a public meeting to further present the methods and results in the report. Staff will then address and incorporate all comments and suggestions into a final report. In drafting the report, staff worked with well-known epidemiologists listed on this slide who served as advisors throughout the project. The methodologies and results presented in this report have been endorsed by these advisors. As mentioned earlier, this report underwent an external peer review by experts selected through a process organized by the University of California at Berkeley Institute of the Environment. Listed on this slide are the 6 members of the panel. They have expertise in the fields of health effects of air pollution, epidemiology, biostatistics, risk assessment, and air quality measurements. The results of this review have been incorporated into this report. One key feature of our revision is the new estimate of the PM2.5 premature death relationship. The other is the estimate of health impacts from exposure to PM2.5 at levels below the annual state standard of 12 micrograms per meter cubed. The basis for these revisions and the associated calculations of premature death are presented in detail in the next several slides. In drafting a new methodology, staff reviewed all the relevant literature. The most important health studies published in the literature are listed on the slide. Also, as mentioned earlier, the US EPA convened a panel of 12 experts to assess the reduction in premature death in the adult U.S. population resulting from long-term reduction in annual average PM2.5. For this process, the experts were asked to review all the available studies to derive the plausible range of values that describe this relationship. While many studies provide significant evidence regarding the influence of PM2.5 exposure on premature death, only a subset of these studies are well suited to develop a relationship to quantify impacts on the general population. This graph displays the results from a few key studies considered by the panel of experts. The dots indicate the best estimate and the lines reflect the uncertainty range. The results show an increased risk of premature death associated with PM2.5 ranging from 6 to a high of 17% per 10 micrograms per meter cubed of exposure. ARB has been using the American Cancer Society study results indicated by the blue line in its health impact analysis. As you can see, many of the studies indicate a risk greater than 6%. Along with the American Cancer Society study, the Harvard Six City studies are often cited in the literature because they both apply to the most general population. The strengths and weaknesses of all these studies, including those listed here, were considered in our review.